live on the street, very degrading. You don't have a chance to clean yourself up or nothing like that, and all you want to do is drink, 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 so you don't have to put up with the misery.
How many people have died on the street in the last 10 years?
It gets pretty cold in the winter, eh?
I used to commit crimes just to go back to prison, instead of sleeping on the street, eh?
There's people out there on the street that used to be doctors, lawyers, bank presidents, in the government, whatever. Something went wrong, whether it was divorce, alcoholism, drug abuse, or just a mental collapse, and it put them on the street.
I've lost everything. Nobody wants me, nobody cares. You live with that long enough, then you start not caring about yourself.
Historically, we provided a very band-aid solution to health problems, and what we're trying to do now is in a meaningful, coordinated way, address the real health needs of our client group. So in coordinating the health services at Seaton House, it provides health services on site.
Deep breath for me. We see quite a few people who have no links with the community or have a very hard time organizing their lives. If they're using the emergency department as their primary care providers, then that's obviously costly. An emergency room visit might be $300, whereas a visit to a primary care physician might be $30. I mean, that's a huge tenfold difference in cost. What we'd like to have is moving towards the chain of getting somebody off the street, into shelter, out of the shelter, into the community, off the street, into the hospital, from the hospital to the shelter, into the community. So it's very, very satisfying to work in a place where you show up here, you see a client, you start a plan rolling, and the next week you see the person again, and progress is made.
Well, I build up a trust with him now, so he knows what's going on with me. If he wasn't here, we wouldn't know what to do.
Well, if it wasn't for doctor support, there'd be a hell of a lot more than dead on the street than there is now. Because if he can't do anything for you here, he will send you to St. Mike's Hospital, where they can do something for you.
To have Seaton House in a clear, defined partnership with St. Mike's could very much be a model for other shelters and other social service agencies to partner with hospitals to provide holistic care.
We have more of a team approach. We have physicians working together in tandem with the social workers, counselors, shelter workers, nurses, and we found that over our last 3 years of experience that makes a huge difference, is actually being there, physically present.
It's an asset thing to have a doctor here. It's really something. I feel more comfortable, right?
It's just nice to know that I've got assistance when I need it. That I don't have to go running out in the cold to go to a hospital.
What we'd like to have is a center of excellence here, where we set the standard of care for how healthcare is provided. And I feel that the work that's being done here is part of social change, and I'm hoping that people will become more aware of the implications of homelessness to us as a society, as well as to individual people.
So, maybe what we can do, Craig, is just go over your existing medical problems.
There's a tremendous amount of satisfaction when you work with somebody who feels like they've never been treated with a lot of respect or haven't had a lot of trust in care providers, and then to develop that trust and to be thanked is tremendously, tremendously rewarding.
They care about each and every one of us that's in here, and that's a lot of people to care about.
The people here are going to help me find a place, eh?
If it wasn't for this place, I wouldn't be here. I'd be dead.
I haven't had a drink in 6 months, and I'm trying to stay sober. Sometimes I'm tempted to drink, eh? I'm fighting it, but I'm winning.